Hey, welcome back to the Layer of Awesomeness. It's Stephen Freeborn here, head of Superhuman Development at RSC, and I want to take a few more minutes out of your day this week to talk to you about another great training tip. Last week we talked a little bit about proper breathing and a drill you can do to help practice that so you can get more out of your training and you can get more out of life. But once someone learns how to breathe properly and do good, deep diaphragmatic breathing, we like to incorporate that into a lot of the traditional exercises we use to train the abdomen, or the musculature of the abdomen and the musculature of the back, specifically that helps stabilize the spine. And we take a kind of a different approach than the traditional mainstream fitness, in the fact that when we train that musculature, we don't typically use it as prime movers of the spine. So we don't do a lot of flexion-based exercises like crunches or a lot of twisting exercises that you would see typically done to train the core. We take more of an anti-movement approach where we're trying to basically teach the musculature around the spine to help keep the spine in a stable, neutral position and protect it from too much motion, which we know can lead to back pathology, injuries at the disc or with the vertebrae. And we take that approach, not that we don't think that the spine should ever flex, we just see that there's very little range of motion at the vertebrae, very few degrees of range of motion at those vertebrae, so we don't think they were really intended to do a lot of big, large movements, and we don't necessarily think it's very smart to try to go about mobilizing the spine more than it should. So we focus on teaching those muscles rather than teach them how to flex the spine and extend the spine. We teach it to resist extension, resist flexion, resist rotation. Now that you know that, we like to then incorporate some diaphragmatic breathing into those exercises. And the reason for that is we know that when we take a deep breath in, our diaphragm contracts and it lowers as it contracts, and that helps draw in air into our lungs. But then we also know that when we forcefully exhale, towards the end of our exhale, we get maximal or close to maximal contraction of our deep abdominal musculature. So that would be like our transverse abdominis and our internal obliques, things like that lay closer to our internal organs than they do to our skin. So our superficial muscles would be like our external obliques and our rectus abdominis, which you think of as the six-pack muscle. And so when we incorporate that, we get a little bit more bang for our buck with our exercises. So we like to do this with like planks and side planks, anti-rotation holds, things of this nature. Because we get more out of it. We teach the musculature how to strengthen and stabilize the spine, and then we also get work at breathing properly, and when we also get increased activation out of the deeper abdominal musculature, which is some of the more important muscles that maybe don't get fired up as much in a lot of our exercises. So I want to take you through what this looks like with a side plank, incorporating good diaphragmatic breathing.
What we'll do is we'll have the client get down on the ground, put their feet straight out, their elbow underneath their shoulder. They'll take a deep breath in through their nose, and then they'll take a big exhale out through their mouth through pursed lips. And when they do that exhale, they're going to raise their hips off the ground. And then they're going to hold that position with their hips off the ground through their entire exhale. And then once they finish that exhale, they'll drop back down to the ground, take another deep breath in, and continue to repeat for the prescribed number of breaths. Say 5 to 10 on each side would be a good goal. But sometimes doing a side plank from the feet can be too difficult. So what we'll have superhumans do to regress is we'll have them flex their feet behind their knees, so they're bent at the knees. And then we'll have them do the same steps just with their knees bent. So big breath in through the nose, big breath out through the mouth, raise the hips, hold through the exhale, and then come back down and repeat. hope you see the benefit in this, and I hope you try it out and see how awesome it is. And if you're ever interested in becoming one of our superhumans, check us out at rsc.training, and we look forward to meeting you. Bye.